This is World Insight with me, Tian Wei. From Delta to Omicron, the world has learned to cope with the worst of the coronavirus variants through breakthrough vaccines and treatments so far. Over the last 3 years, China has been actively involved in global anti-pandemic efforts by funding, donating, or exporting vaccines and medical aid to the global community. How can we, together, better prepare for living with COVID in the future? On that, I talked to Gavi CEO Seth Berkley in our special program, The Turning Point, China's Rebound and Global Recovery. Dr. Berkley, what a pleasure to see you here.
It's great to see you again as well.
Last time our conversation face-to-face, 2020, it was just the start of the realization that there might be a pandemic.
It was very interesting because it was here, and of course many people around were saying, no, it's going to be over in a little bit of time, but we thought at that point it might get bad, and so we began the planning for what ultimately turned into COVAX at that meeting.
So we have seen discussions about the efficacy of vaccines over the past few years as to comparing one vaccine to the other, as many of the vaccines already been adopted by COVAX. Dr. Berkley, how do you see the discussion and the nature of discussion of these?
Well, one of the challenges we have are that in general vaccines are made by the private sector, and they have very little incentive to test their vaccine head-to-head with another vaccine. And they have even less incentive to do mix and matches, where you might use one vaccine for the first dose, a different one for the second dose. And so it's been very hard to get a comprehensive answer on what's happening. I think the good news is that the vaccines, by and large, protect against severe disease and death. And they've continued to do that even with some of the new strains that have come out. What I think has been disappointing to everyone is that we haven't seen infections reduced as well now. At the beginning, we saw a reduction in infections, but with the new strains, the new variants, infections continue to occur, and that's hard for the population to understand because I just got a vaccine and then I get infected. They think, well, it's not working, but what you're trying to do is protect against severe disease and death.
So, Dr. Berkley, tell me more about your thoughts on the IPR, since you're working for many of the vulnerable groups.
So it's an interesting issue. We have a word in English called a red herring, meaning that it is not necessarily related to the problem at hand. So intellectual property is absolutely critical for drugs and small molecules. And we have a history in public health of the anti-AIDS drugs, which I know you've worked on. They didn't transfer IP or give licenses, and so there was a block of generic companies being able to produce them. So the public health advocates have really said we must deal with IP. The challenge is that vaccines are different. Because they're made from living things, the critical issue is actually the know-how. It's how to grow it, how to assay, how to test it, and you need all of that information. So what we need is cooperation between two companies or companies and public sector agencies, producers, and there may be a little IP in there, but the IP is not the main problem. So many companies have said, we're not going to protect our IP during this period. That didn't bring us any vaccines quicker. And we need to make sure that we have this ability and incentives in place to be able to transfer technology, as you described China doing to some other countries.
So, Dr. Berkley, in reflection, in retrospect, how do you see the journey you took together with COVAX and partners?
Well, first of all, the reason we did it was because if we looked at the previous pandemic of flu, none of the doses got to the developing world. What happened is all the wealthy countries bought up the doses. So some people have said we're naive, but we knew that was going to happen. The question was, could we around the edges do better and move forward more equitably? And so what actually happened? So for the first time, obviously, the science moved very quickly. You know, we had our first vaccine in 327 days, which is amazing from the first time that the sequence was published. But we also had the first vaccine in a developing country 39 days after it was in a wealthy country, which is amazing. We were on the process of moving forward with larger volumes of doses, but then of course what happened is we had a number of export bans, we had some vaccine nationalism where countries didn't want to have their vaccines distributed, and it made a very difficult process. But our goal for that first year was 950 million doses, and we got about 900 million doses distributed, so we came very close to hitting our goals. Now we've distributed 1.9 billion doses, and the coverage rate in low-income countries is 53% as compared to a global coverage of 64%, which isn't equitable, but we're getting there.
Dr. Berkeley, from pandemic to epidemic, how do you see the role of COVAX in the future?
Well, what we need to do is, of course, learn the lessons, both good and bad.
What are the bad lessons? You know, as a media, I always ask the critical questions.
So on the bad side, we had this nationalism. How do we work around that? We had export bans. How do we work around that? And there are solutions. For example, we're working to try to distribute manufacturing more broadly, so that might be able to get around some of that. We also had many innovations that weren't done. Simple things like, what kind of label do you put on a pandemic vaccine? What language is on it? Do you put an expiration date? Because when they're new, they last for a very short period of time and you can extend it. So we had to go through a whole set of learnings, and the challenge is to keep those alive and to make sure that next time we have all of those learnings and we can move immediately. But two big ones. One is we obviously didn't have money at the beginning. And so what we're calling for is a set of contingent finances that could be available so we could jumpstart right at the first day of a pandemic. The second is the ability to take risk. If you want to move quickly, you've got to start, you've got to invest in vaccines, which we ultimately did before we knew if they worked. But to do that, you've got to get the community, the board, the donors to accept that fact.
So, Dr. Berkeley, your comments about the latest shift of policies, and of course, in terms of vaccines, what is still the best approach?
We need to make sure that the high-risk populations are fully vaccinated. And the reason that's critical is because they have 10, 12, 15 times the risk of severe disease and death as is young, healthy people. Now, young, healthy people also have a risk, and they need to protect themselves as best as possible. But at some point, of course, we have to go back to living, but do that, wisely. So making sure that people are using preventive measures in closed spaces, like on airplanes, and then making sure that those high-risk populations are vaccinated and boosted, because these vaccines do not provide protection indefinitely. And these are the priorities right now for us. In the developing countries, which is our primary goal, we have now 81% of health workers vaccinated, but only about 66% of the elderly. That should be 100% and 95%, and this is what we have to move towards.
But Dr. Berkeley, how do you see currently the approach? Because people are worried with 6 months immunity, there's likely to be other waves, and what is the way to deal with other waves? So there is some kinds of naivety among the public about, once I get it, I probably can be spirit-free. So,
first of all, we have to keep in mind, we have to be humble. This is the first time we've had a truly global pandemic. What we've learned about this disease is it hasn't settled down yet. It's continuing to mutate and change. And with that, we're seeing strains with increased infectivity, and we're seeing that people can get infected multiple times because they have strains that work around the previous immunity. As I said, so far the vaccines provide protection against severe disease and death, so our recommendation is to continue to use those, but not rely on them to completely protect you, and that's why the other methods are also critical. At some point, we presume that this will slow down. It's changing, and we may get to a steady state or not. As you know, influenza, every year we have a new vaccine for it because it is constantly changing. Other diseases get into a stable place and we can create a vaccine. And what we need is a vaccine, of course, that works against all coronaviruses. So not just this one, but SARS and MERS and whatever the next one will be.
So how do you see whether we are learning the lessons of the pandemic at this time of COVID? Would we have better memories and better skills?
Well, my hope would be that we've learned. And one of the reasons I'm here at Davos this time is to make sure we keep this on the agenda, because our previous history is panic, neglect, panic, neglect. And I worry that with all the other crises, the polycrises that are going on, that it's easy to stop thinking about pandemics. And yet it's evolutionarily certain that we're going to have more pandemics. And so the challenge is to make sure it remains not the only priority, but one of the priorities for political leaders. The other thing is, we don't know where the next pandemic will come. We don't know what it's going to be caused by. So we need a level of pragmatism and flexibility, but also a sense of global engagement. And I worry that this has become very politicized. The use of vaccines has become politicized. Who should be getting them, which vaccines, and that makes it very challenging, because at the end there's only one thing that can take us safely through pandemics, and that is transparency of good science.
What do you see as the emphasis of work for your organization after this pandemic?
So first of all, the role we had before is to strengthen routine immunization systems and to vaccinate the world's children. And, the good news is about 90% of the world's population receives at least one dose of a routine vaccine. In China, it's 99%. But, and so the challenge for us is those numbers came down during COVID. Of course, came down about 5%, but during COVID, countries delivered an additional 4 billion doses of vaccine. So in some sense, it's surprising it went down that little. But what happened with it going down is we've now seen outbreaks of polio and outbreaks of measles and outbreaks of cholera and other diseases. So we need to restore routine immunization. We need to continue the climb to get to as close as 100% as we can. And we need to have systems in place that are ready for the next evolutionarily certain pandemic. So those are the activities we're doing. And lastly, of course, we keep the stockpiles for things like Ebola, yellow fever, meningitis. And we need to make sure that those stockpiles are ready, because this year we have more cholera cases than we've had in the past. Yellow fever is up, and Ebola, we've had a number of outbreaks. And so the challenge is to work on all those fronts at the same time.
Finally, before we go, the past 3 years, if you could use one adjective, which one would you choose?
Exhausting.
I had great empathy for that.
Thank you. Very nice to see you again.